Thank you, Pat, and thank you for that excellent presentation, really illustrating the importance of this route of exposure to PFAS chemicals. Now honored to introduce Hope Grosse from Bucksmont Coalition for Safe Water. Hope is the co-founder of Bucksmont Coalition for Safer Water and serves on the National PFAS Contamination Coalition, working to establish enforceable federal and state drinking water standards for this chemical class. She acts as a main point of contact for community outreach and leads social media efforts. She's the community liaison, updating residents about PFAS water contamination and related issues. Great. Hope has been featured on WHYY's Radio Times Live with Marty Moscone, discussing PFAS chemicals health and regulations. She also serves as a community representative on the Warminster Naval Air Base Technical Committee, charged with oversight of the environmental cleanup under CERCLA. Hope Grosse grew up directly across the street from Warminster Naval Base and also worked on the base after high school graduation. Her father died of cancer at 52 years of age, and she was diagnosed with stage 4 cancer at age 25, which quickly spread to her lymph system. Other unexplained tumors have also been removed from her body over the years. After learning that the Warminster Naval Base was named a Superfund National Priority Site, she began to get involved in environmental advocacy and was committed to bringing awareness to others in her community. Although she is primarily concerned about PFAS water contamination, she's also concerned with the combined and cumulative effects of the 75 other harmful chemicals she was exposed to, many of which were found at dangerous levels in water, soil, and air in her community. And with that, I will turn it over to you.
Thank you so much for your introduction, kind words, and thank you for letting me be here today to share some more information. I do have a slide presentation. I don't know if we can pop that up right now. So my neighborhood is Bucks and Montgomery County, Pennsylvania. We first found out about PFAS in our drinking water in 2012. Where we live, we have a different kind of water system where we have actually private wells that feed to a public water system. So over 30 wells were shut down in our town when we found this out. Today, public drinking water systems deliver water to our homes under the EPA HOW. But private wells owners are still at risk due to uncontained plumes at both DoD sites. I'm actually by the Warminster Navy Base, and in 5 miles from where I grew up, there's the Willow Grove Navy Base. So we have 2 Superfund sites within 5 miles of each other. We know today that we've been drinking PFAS in our drinking water since the 1970s for me. That's over 50 years. I have, along with many other residents, have had a lifetime exposure of PFAS. We are your health study. I feel like we talk about this a lot, like study us, think about this, a lifetime of drinking poison. It's a lot. Next slide, please. My story that you've just heard, and I was able to comment in the last meeting and shared more of my story. But I want to stress the unbelievable lack of trust, fear, psychological scars that I've endured, not only in my family of origin, in the loss of my dad at a very young age of 52, my stage 4 cancer at 25, and some neighborhood losses and deaths of neighborhood parents, but my own shame as well and fear of what I've done to poison my own children, my own 2 girls. I would have loved to have options for that. Options on filtering water or possibly bottle feeding my babies because I breastfed them. I cannot change these things today. So I choose to move forward for the health and well-being of all the other children, born and unborn, and for the mothers and all of our community. Please be a part of this change today and stand alongside me, and not just me, but the hundreds of thousands of other people who have been exposed to PFAS all over this world. Next slide, please. Our community was exposed through drinking water and private well water. Before we get into our concerns and challenges, though, I want to point out that our local water authorities actually cleaned the water within a quick amount of time to get it to the EPA HAL. So that was amazing. But because of the high levels of PFAS in our local authorities, we were forced to buy water from other sources. And this too was a cost for the community, not just the water companies. Financial implications can be staggering for the average community member that lives in our area, not only to cover the water, but expenses of medical bills, bottled water, home filtration system, diagnostic testing, chronic illnesses, results in loss of wages and work and happiness and productivity, and sometimes the loss of life. And unfortunately today, PFAS is still traveling from the Department of Defense site into the surface and groundwater that goes directly to our drinking water source. So we do need to stop this pollution. Next slide, please. This is, we have had a little bit of studies done in our area, really not blood, but this was a cancer review done by the ATSDR zip code study, which you all may know about or may not. It would be a good thing to look up. I just want to acknowledge that this was a superficial look at select cancer outcomes in zip code affected PFAS contaminated water. After the zip code study was done, there were other, like I said, similar studies done in the Warminster in late 80s by the Pennsylvania Department of Health for childhood brain tumors and birth defects due to some residents' concerns at that time. I want to just note that these studies had the same limitations as the ATSDR zip code study. The fact that it always compares results to other zip codes in PA, and that PA is considered and ranked one of the top 5 worst states in regards to cancer incidence. And in this ATSDR report, you can see some findings of bladder cancer, kidney cancer, liver cancer, prostate, testicular myeloma, and you can look at that later. That's available at the presentation for everyone to see. Next slide, please. Now, these are a list of diseases that personal emails that I've gotten or Bucksmont Coalition have gotten through the email of different community members and their health effects that are in our local community. Our town has faced fear, social anxiety, death, emotional and physical stress, and they feel like they're forgotten. When I would go to the doctors and tell them about some of the exposures of over the 50 chemicals that I was exposed to, the doctors would laugh and say no. And clearly they didn't have any information about environmental components. They made me feel small. They made me feel stupid and embarrassed, even just asking the question. And I was treated at Sloan Kettering in New York City when I was first diagnosed. And I stay with Jefferson Hospital in Philadelphia. And to this day, there is no acknowledgement of environmental exposures or PFAS. Next slide, please. This is the PEAT pilot study that was done in Pennsylvania. This was the only blood study that was done. The PA Department of Health and ATSDR put this study together. It was a lottery, so it wasn't the highly exposed. It wasn't volunteer. They picked who it went. It was like a lottery. They didn't pick. It just went out to different people. So we have over 85,000 people in our community, and 234 people were chosen and did the study. So as you can see, the high levels of PFOA, PFOS, PFHXS, and PFNA were one of the extremely high levels. And you can see on this the comparison to the NHAIS results versus the PA results. And our results are higher in all 4 of these PFAS compounds. And to me, that's pretty alarming. Next slide, please. This is just another breakdown of the PEAT study, just for you to take a look at and see just the high rate of PFAS in our blood. These residents have nowhere to go to seek help with their blood levels. So there's 234 people out there that have extremely high PFAS, and they often ask us, what can I do? What does this mean? how can I get PFAS out of my blood? There are no recommendations. There aren't any doctors in our area that can help us. And how scary is that, to know that you have a toxic chemical in your body and you have no control over it and have nothing, of how to get rid of it. Next slide, please. The value of testing in our community now, testing is imperative, because we need to know we know over time that these chemicals leave our body, and we have the right to know exactly how high our exposures were and what we can do about it. So if we don't test the blood now, we're not going to know what our exposures were, because they are leaving our body slowly. We need to know detection levels. Next slide, please. The short answer to this is no. We have the right to know what we were exposed to and those health effects, regardless of the answer that comes through the evidence-based science. So obviously, we need to get it documented now. Again, like I said, we need our blood drawn. We need it documented so that when the science catches up to the blood, then we'll be able to go back and know what our exposures were and what it exactly means. Again, we have the right to preventative health measures, whether it's testing, tighter testing to see if our vaccines are working, which would be an amazing thing. We could do that now for not much money. To see if our children have effective vaccine, we could have blood monitoring to check associated health effects, like increased liver enzymes or high PSA levels to detect cancer and other diseases early, giving us the greatest chance to survive and or having a good quality of life. Next slide, please. Protecting our children. Our children are at the highest risk from drinking water contaminants because they consume twice the amount of water as adults based on their body weight. Children are also the most susceptible to be damaged from toxic exposures. It is the utmost importance that we protect our children's health. And we're begging you today for proper guidance on this. We know certain PFAS cross the placenta, and that PFAS has been detected at a very high levels in breast milk. We know there are multiple health problems associated with early exposure to PFAS. This slide has a few notes. We need to provide guidance to mothers on breastfeeding. If mothers have high blood levels in PFAS, it's very probable that it's going to be passed on to their unborn baby through their placenta, leaving their baby with already high levels of PFAS in their bloodstream. Do we really think it's safe then to breastfeed and further their exposure? Mothers should have guidance to test their blood levels during their pregnancy and later testing their breast milk. Although it's a great loss to the infant, practices like pumping and dumping for a time period may be the best practice to reduce mothers' levels of PFAS and safeguard our infants from further exposure and potential devastating health effects. Next slide, please.
Hope, this is Ned. I'm hoping that you
I'm wrapping up.
Thank you.
Thank you. Sorry. Our community needs trust that our physicians are knowledgeable and can help. Medical forms should add questions like, have you been exposed to chemicals? Where did you live? How long have you lived there? Physicians and insurance companies need to collaborate so that physicians can issue prescription for blood work, x-rays, testing, and that these tests aren't denied. We need testing for preventative health. Training our physicians is extremely important. And why not offer state-driven continued education, mandatory on PFAS education? Next slide. Thank you all for listening. And nothing about us without us is basically what we came up with at our national coalition. So I think we really appreciate that we are a part of this, because I feel like you need to hear from us how we feel and what we've been drawn through. And thank you again.